Just wanted to say thank you everyone for joining us today for the Patient Partner webinar series on what life is like through and after bariatric surgery. My name is Patrick Frank. I'm one of the co-founders of Patient Partner, and we are super excited to be sharing the screen today with Mr. Dr. Hanna and one of his past patients, Rana, who will be really, discussing the ins and outs of, what life is like going through bariatric surgery, what life is like after weight loss surgery. And Dr. Hanna is really going to be talking to us a lot about, what recovery can truly be like. He's going to be answering a ton of your questions that you guys asked when signing up for the webinar, along the lines of, what is your diet going to look like, the changes that you're going to be making in your life, and just give a ton of information from his years of experience in the field. And Rana will be sharing so much about her story, about what her journey was like, and be able to give that more, personal side of the story of, what the journey, truly is. But before I pass the floor off to the both of them, I wanted to introduce Dr. Hanna in a little bit more detail because he has been such an awesome part of what we're building here at Patient Partner. And so, one of the biggest things is that people ask, what is Patient Partner, right? And, very simply put, we are a platform that has been built to build a community of patients to connect one another through relatable experiences. We are building this platform for all conditions, treatments, and procedures to help simplify the healthcare journey for all different types of patients. And, one of the biggest and most impactful ways we have found out how to do this is to connect patients who are, really contemplating this next step in their life and in this journey, and connecting them to people who have already been through it before, and learning directly firsthand what that journey is like, both from a medical professional and from a real life experience. And those folks are called patient mentors. And so what exactly are they? Well, they are your accountability partner. They're your confidant. They are the person that you can go through and really talk to about what is my life going to be like before, during, and after my healthcare event. And they are 100% volunteers that are dedicating their time to share their experiences with all different types of patients, and to really, to allow folks to see their future selves in. And the goal is to guide you through every single step, both from the professional side and the personal side. And that is what we at Patient Partner here are all about. So of course, now with no further ado, I want to introduce Dr. Bernie Hanna, who has just been amazing supporter of what we're doing here, and has been incredibly impactful in building this platform for patients. He is honestly just redefined, the idea of bariatric surgery in the sense where he truly approaches it like a journey, right? Emphasizing nutrition, fitness, the diet, all the changes that truly make up, what your life is going to be like. And one of our favorite quotes that he says, and I've said journey many times, but he says, health maintenance is a journey, right? And it is a huge and such an impactful point of our lives. And he teaches patients how to really, spearhead this and lead on a healthy lifestyle, starting today, tomorrow, and into the future. He specializes on the forefront of bariatrics, being involved in surgical research, and is internationally sought out as a speaker. So in other words, he's just plainly and simply awesome. And we couldn't be more excited to have him here today. Some of the things that he's going to be covering today are the ins and outs of what to expect from surgery, really understanding, the diets. He's going to be talking through a lot of, how knowledge is really the power that you have as a patient, and how to utilize that through every single step. And really, he's going to allow, Rana, who is now here, to give her personal side of the story and what it means to be a recovered patient. So without any further ado, and I know I said that a couple of times, Dr. Bernie Hanna, thank you so much for being here. We couldn't be more excited.
Yay. Thank you, Patrick. I'm so excited to be here too. This has been quite a journey, starting out with Patient Partners, as you have given us the platform to allow our patients to really be a whole part of this community, and encouraging individuals who really want to do this. And Rana is here speaking with us today. She's a living testament to what bariatric surgery success is all about. So it's just amazing, and I'm excited to share our views, our points, and what our practice and program is all about. Like you mentioned, this is a journey that starts and never ends, and we are here to follow it all the way through with you. Bariatric surgery now is at the forefront of weight loss. It's been around now for 30, 40 years. And this past few years, we have streamlined bariatric surgery to where it's actually safe and it's very effective. Individuals who are trying to lose weight, they've been struggling for many years. Obesity, it's a huge problem. I mean, our obesity rates, 60 to 70% in the United States, is just out of control. And surgical weight loss solutions is the ultimate solution for patients who have exhausted everything that they've tried. So when we are assessing someone who wants to look into weight loss and weight loss surgery, we use a certain criteria. It's called the body mass index, BMI. So we take an individual's height, weight, we put it in this table, this chart, and this number comes out. So if a BMI is over 40, which is someone on average who's about 100 pounds overweight, they're a good candidate for weight loss surgery. Now, when you talk about obesity and the health issues / comorbidities associated with obesity, such as diabetes, hypertension, obstructive sleep apnea, back pain, joint pain, they actually lower that weight limit for you. So a BMI of 35 up to 39.9 with a health problem, you're also a great candidate for weight loss surgery. So, we've been seeing now a huge influx of individuals who are coming to us, especially during this pandemic, the past 2 years, where individuals are at home, they're not back doing their regular daily activities, working from home, children are at home, homeschooling, so activities are less, access to gyms, all of that is less. So now individuals now are looking for more options to explore surgical weight loss.
It's almost as though what was already difficult has been made more difficult by the changes, that COVID has really pronounced to the world. It's become a whole new set of challenges.
It's totally escalated.
And I'm sure that you get asked, a ton of questions, right? And a huge portion of this is like people on the forefront thinking, gosh, like what are the logistics behind this, right? Like what are all the steps? What are the things that, I need to know before I head into this? And, just from working together with you and the patients that are on our platform, these are some of the ones that I'm sure you've seen a ton of. Can you talk us through, kind of some of these, like, the recovery aspects, when it comes to work, how much time people are going to take off, and really how long, do they have to wait to get back to their normal routines of exercise and moving around?
Certainly, these are very common questions. We see it every day, all the time. When someone's considering surgery, you think about surgery as a big deal, right? And am I going to be down for weeks and weeks? How much time am I going to take off from work? But we've streamlined bariatric surgery now to where it's minimally invasive, that is tiny incisions, very minimal trauma to the body. So our surgeries now take about 20, 30 minutes, literally in the operating theater, and an hour later in recovery. So patients are up walking around right away. So the recovery can be actually pretty smooth and much easier than it was 10 to 20 years ago. So typically I tell my patients to take about a week off from work, okay? But that 1 week that they're, recovering, the energy level is a little low, but they'll be doing stuff throughout the day. You'll be up walking around, you'll be doing your daily activities, but not strenuous activity because you're on a modified diet. You're on a liquid diet, bariatric clear liquids. You're talking broth, Jello popsicles, Crystal Light, certain protein waters. So minimal caloric intake. Throughout the end of the week, energy level picks up. The second week, you're on a full liquid diet where you're getting protein shakes, the meal replacements, creamy soups, yogurt. So now energy is a lot better. This is when patients can start going back to work and getting back to their regular activity. So that 1 week off, but I always stress that if you want to take more time off, just do it and learn how to do this the right way. When it comes to exercise, that first week you're just walking, do as much as you can around the house, go outside, especially when the weather is nice, like here in Vegas today. And you can go outside, walk a block or two, and that's okay. But the second week, I encourage patients to start getting back to their routine exercise that they would normally do, such as light gym stuff like cardio, elliptical, treadmill, and light resistance. So the second week, they can start doing all of that stuff.
And I mean, I think one thing that has been really eye-opening. I mean, one of the very first things that you spoke about was the amount of time that the surgery takes, and this concept of minimally invasive. I feel that there's a very large misconception around, there's this gigantic opening. It's this very, very, detrimental, surgery on my body. I mean, that's a pretty eye-opening piece of information of how quick the surgery can be, and the fact that people are up and walking,
Yes.
right out of the gate.
Yeah, because we do medical tourism also. So patients fly in from out of town, out of state, out of country, and we do surgery like this. Say a gastric sleeve is done in the surgery center, and they go home right away. So it's outpatient, or they go to a hotel, and 2 days later they're flying back to wherever they came from.
Amazing. That's amazing. And so much of that too is obviously the folks who are curious and who are going through this, their top of mind is concern about their health. Right. And these two questions are what motivate a ton of patients to go through this journey. And the first being, what will my comorbidities go away? Things like diabetes, right? Things like CPAP.
Definitely. And that's one of the main reasons why we really do this. When a patient walks into my office and we start a conversation, one of the questions I ask is, why are you doing this? So there are many, many answers that come with this, but a lot of it, and the majority of the answers are for my health. Health is key. You can't put a price on good health. And especially someone who has health issues already, such as diabetes, high blood pressure. I mentioned these two before. And if you have the propensity and genetics, family history of heart disease, hypertension, diabetes. So you certainly want to maintain your health so that you don't end up getting these health issues later, especially when you're overweight or obese, because the chances now that you will develop these conditions are much higher. So comorbidities do certainly go away, and the data is out there. Diabetes, 82% of our patients come off of their medication. Hypertension, 70% of our patients come off their blood pressure medication. Sleep apnea gets better, joint pains get better, a whole host of health issues improve and get better. So it's a huge, huge impact on the health and well-being of these patients post-bariatric procedures, and we see it every day.
And that to me, when we first really started chatting and learning so much more about this procedure, that is just an incredible stat. I mean, people don't think they have a solution. They go to medication, they go to whatever they can, realizing that this actually solves more than just the initial issue that people approach it from, which is, hey, I want to go through the weight loss surgery, but then they find out there are all these other benefits. And of course, it brings them back to, that original question, which is, I'm sure this might be the number one, is how much weight can I expect to lose? Right? What is the end result of this?
That's the exciting part, because the expectation, they're like, oh my God, everybody comes in with a goal set a goal. And look at who we're looking. I mean, we're looking at Rana there, but now on the screen here is Serena, 112 pounds. And typically the average patient that comes to us is on average around a 40 BMI, 100 or so pounds overweight. And that is the typical number that most people will lose in our program. So on average, most people lose up to 100 pounds or more, depending on where their body mass index is. And this starts right away, day one, on that clear liquid diet. Our patients lose 1 to 2 pounds a day over the first few weeks. So that first month, most patients may lose 20 to 30 pounds. So it's just rapid and right away.
Yeah, that first week was the scary part when you get on that scale. And like I said, I lost the 8 pounds the first week on the clear liquids. Mentally, I wasn't prepared for that much of an amount as well. So when that happened, I literally jumped off that scale and I got scared. I'm like, is this normal? Not knowing, again, what I'm expecting to come. But it was a lot of, obviously, weight that I needed to lose. But that 8 pounds said, oh, I could do this. And that's what kept me going after that.
Yeah.
I mean, it's that continual check-in. It's that continual win that you're seeing day in, day out. I mean, that alone serves as a motivator, every single day where you're seeing that improvement and change in your life. Because it's not easy, right? I mean, speaking about the diet side of it, I mean, there are definitely changes that have to happen. And a lot of times people don't necessarily know what those are. They might haven't, they think they do, but they don't know the actual process. I mean, Dr. Hanna, this is somewhere where I know you place a lot of focus in, and you talked about it a little bit, but what is it that folks are, what is the, kind of the pathway of what they should be, ingesting, after surgery?
Yeah, well, it's all about education, as you mentioned before, Patrick, and Rana knows this too. And I mean, going into now almost 7 years out, Rana knows the struggle with eating, knowing how to eat, what to eat, when to eat, all of this. We teach our patients, so it's all about education. Everyone sees a dietitian and nutrition expert before surgery. So the education comes before, so that the expectation after is there and you know what to expect, you know what to do and how to do it. We tell our patients, listen to your body. Focus and pay attention to being mindful on your choices. If I do a gastric sleeve and I make your stomach 1/3 the size, so a stomach down to the size of a banana, you will eat less. Also less appetite, less hunger. So in eating less, you have to put good nutritious food in your body. So the choices do matter. So we tell patients to focus on eating fresh, eating clean, vegetables, lean protein, this sort of stuff. What can you eat? Once you're on that phased diet, liquids to full liquids to creamy stuff, soft, mushy foods, back to regular food. This is a 6 to 8 week process after surgery. You should be able to really eat whatever you want.
Yep.
Once you know that the choices do matter, okay?
It's not what you eat, how you eat. That's what I always say to myself.
Yeah.
I used to go out, that would always be the thing. And like you said, Dr. Hanna, you could eat anything, but remember how big your stomach is. So you got to be mindful of what you place in there. So that way it helps you with energy, with your thought process, with your body. It goes so far what you put in your body. So it's
exactly
a process. It's a little process that you have to learn. You have to listen to your body, and that's a key word as well. Because once you listen to your body actually tells you what they want. There are times where I feel like my body's craving certain things. That's probably because I'm missing certain nutrition in my body as it is. So I listen to that. I go for it. I eat very well every day. I know I do. There are days, where I don't, but if I'm going to eat something today, let's say I had cake, I'm going to have cake today. I'm going to be mindful for the rest of the day how I'm going to eat so I can have that cake and not feel guilty and not feel all that hard work that I've done. It's a process. It really is.
It really is. Yeah.
Man,
I mean, you think about the analogy with, okay, I'm going to have a piece of donut for breakfast, or I'm going to have a boiled egg. Which one is going to sustain me and get me throughout this day for the first few hours of the day, right? So that's the thought process.
And I love this statement of, it's not what you eat, it's how, right? And this is the change that, you have to really make. And because a lot of people just focus on what's going inside their body, but not, how it affects them and the process in which your body digests that. And that's a major change that leads to, consistent changes throughout one's lifestyle, because, I'm sure you can speak to this as well, which is, you're not just in this for the moment and that quick change. This is a change that affects you in the long term that has such a larger impact. Other than just the weight loss, there's all the health benefits that we were talking about earlier.
Right.
And I mean, those changes come in more ways than one. And the physical side of this, I mean, it's massive, right? And these are, I'm sure, again, these are here for a reason. These are the ones that you get asked the most. And there are those physical changes that people go through. Talk us through a little bit about, what happens here, right?
Definitely. Yeah. And on the previous slide, we we skipped over the supplements. So we have to mention that you have to take your vitamins. Bariatric patients must take vitamins, which are bariatric vitamins, multivitamin, iron, calcium, B12, this sort of stuff, so that you do not develop micronutrient deficiency. So think about taking a Flintstone vitamin every day. So it's not that hard, but you have to supplement. Now, moving on to the next topic about the skin, scarring, would your hair fall out? These are common questions that always come up too, you know? I mean, depending on the amount of weight that an individual loses, this may determine how much excess skin or laxity there is. There are many factors with loose skin. There's age, there's genetics, there's skin type, there's how much weight you've lost and how much you've stretched that skin out. So if someone loses 100 pounds, it's very different from someone who loses 200 pounds. So now you're talking a lot more change in that body structure where you will have some loose skin there. So if there is extra skin, you just look at, if you're not comfortable in your body, this is when we refer patients to a cosmetic and plastic surgeon. And typically we tell patients to wait about 18 months, which is a year and a half up to 2 years after your surgery, so that you're in a good, happy place and plateaued before you address that. Scarring, as far as the procedure that we do, it's like I say, minimally invasive. You're talking tiny incisions, okay? Less than a centimeter. These little incisions heal so well that a lot of times it's even unnoticeable. So you really don't see much of a scar. When you talk about hair loss can occur, or hair thinning may occur that first 6 to 9 months. This is the rapid weight loss phase when the body is under stress and you're losing a lot of weight. So it's very important to make sure you're putting the right nutrition in the body. You're taking your vitamins and you're getting your protein intake. We encourage patients to take the biotin or hair, skin, nail vitamins to supplement that. That's B7 to supplement, so that decrease the chances that hair loss will occur. But once the weight loss is done, a year or so later, and you're plateaued, now you're on maintenance mode and you're in a happy place, that hair loss should stop and recover and you get back to normal. So I always tell my patients, you're not going to go bald, okay?
Yeah. And Doctor, and that's something that's super unique about, you know, kind of the pathway that you give to people, is that you kind of provide this entire plan, right? Because it's not just one portion of it. It's the supplements, it's the diet, it's all of these different pieces that you're touching on. And you know, correct me if I'm wrong, but as you're going to get as much of it out as a patient as you put in. Right. And so
and look at Rana. Look at that beautiful head of hair. Look at that.
Exactly. There's no shot. I mean, hair fall after surgery. This is living proof.
My vitamins.
There you go.
Right. That is right. Which again, that pathway, I keep referring to that, but this is a huge differentiator that I think, you know, is the reason why you're talking with all of us today and to everybody, which is, you know, this community aspect. And you've done a phenomenal job of, one, being an incredible part of our community, bringing amazing patient mentors like Rana to be part of our community as well. But this is a huge part of saying, you know, after you go through this, right, where can I turn? Who is there, right? How can I, you know, what kind of access do I have to other folks? Talk to us a little bit about, you know, what you've done in the past, what you're doing now, and what patients can expect out of the community.
Yeah, for a complete and comprehensive program, support is key. We tell individuals, you know, when you come to see us, you should have someone close to you, family, friend, loved ones, who is your support system. Outside of that, the bariatric program is your support. We are your ultimate support. I tell you that you're my patient for life. We follow you forever. So we're there. We do support groups. We have support groups. Prior to pandemic, we would have support groups in our office twice every month in our waiting areas, and it was always full. We had topics where we would have guest speakers come in, nutritionists. We'd have a psych doc may come and talk about emotional stuff. We may have a plastic surgeon, a guest speaker, come in and talk about body contouring and stuff like that. So we're always doing support groups. Now we're doing that on webinar. We also have all of our social media outreaches. We have Facebook, Instagram, Twitter. We have all the platforms. We're on there. We have over 70,000 followers on Instagram. We have a Las Vegas bariatric group on Facebook. So we're there, you know, we're a part of your community. And now that patient partners here, that just added a huge component to what we do, because now we have our patients, our living proof, Rana, who is a mentor for you. Yep. So, you call in and you can actually talk to Rana, who has gone through this process and done it. So this is like, I say it again, get it from the horse's mouth. Okay.
That's it.
It's very amazing. True. I didn't have that much support. I didn't have somebody who's been through it. I didn't have somebody that knows the process. And talking 7 years ago, it wasn't as big as it is now. But I mean, with Dr. Hanna and his team, I mean, I remember the next day I gave a call. I didn't know what was going on. And right away, Dr. Hanna called me back, and he talked it over with me. And then when I would go into the support groups, same concept. So knowing someone who's going through it, or knowing someone that has seen it, it's a big difference. Yes, you could have those around you that can support you, but there's certain things that, what do? Google? We can't Google everything, can we now? Right. So we call our mentors, and that's what they're there for. Everybody is different, but everybody's been through the same change. So we can all go through it the same way, and success in it, and see what can happen down the road.
Google knows everything, but then you want to make sure that you can filter out the right information from Google, Correct. So that's why we're here, and we actually can give you the right information.
Yes, definitely. Once again, I had my surgery over 6 years ago. Come February, it will be 7 years. And the struggle is real. I've struggled with weight loss since I was 13. Yo-yo diets, the pills, the drinks and everything. But, at some point it's a mindset, because when you're on a diet, you're like, I'm going to do this today for a month. But you don't learn once you have the surgery, then you learn it's a process, it's a lifestyle, and then you grow. Getting a question. I lost 96 pounds.
There you go. Oh, someone asked a question. Okay.
Oh, sorry. Someone did ask a question. So yeah, I've lost 96 pounds during this process. And, it fluctuates. There's always that 5 pounds that go up and down, up and down. Yeah. But at the same time, I just remember and when you stress about it, it doesn't help, because your cortisol levels go up, so you just keep going step by step. At the same time, when I thought about gastric sleeve, I didn't even know that was something out there. I didn't know that was a possibility. I was thinking surgery, like you mentioned, Dr. Hanna, surgery. Oh my God, it's going to be invasive. It's going to be a process, going to need time down. I know you, at that time, you said 2 weeks. And I remember on the 5th day, I was out working. I was back to work. The process of it was, I was borderline diabetic. I had back pain, severe back pain, constantly. Sleep apnea was the worst part of it. Now, and no energy, no confidence, all of that, all at the same time. And so from there, when this opportunity came, and I met with you, and I think I came about 3 times into your office to talk about things, because I had questions. I didn't know what to expect. So that right there, I think, was a big turning point. Was, wow, there is a life after. There's so many ways of going through things that you don't know what to expect. And at the same time, I was a single mom, didn't know what to do, didn't know how to start life. So this opportunity made me grow as a person as well. This was the best decision. Anyone that's had these struggles, being part of this beautiful mentor product, I do have that love for it, because I've seen the change. I've seen what it's changed to my life. I've seen my lifestyle, how it's changed. So it's an opportunity for those who want to learn more. This is the place to do so, with patient partners and with their physicians around town and stuff. So it was a good time. My biggest struggle always was, the first year was my biggest struggle, to be honest. To eat, how to eat, energy, trying to learn my body. And so it took a while. And then overnight, and that's it. And, it's one of those things, even when the pandemic occurred, I remembered, I'm like, what am I going to do? I'm not doing my yoga anymore. So what next? I ordered a bike on Amazon. So
There you
that's what
go.
we did. And that's it. I'm like, I'm not going to stop, because
Yeah.
gaining the weight is so easy. It's so easy. But when you're mindful of how you're eating, it's not that easy. So it's just being smart about that stuff. So
That's key.
One thing I'll jump in at is we could hear the conversation going on one of our computers, and what I'll say is this, guys, is like, Dr. I think that this really speaks to the relationship that you build with your patients. I mean, just how natural the conversation is, how natural the relationship is, and your guys' ability to, really work together. I mean, in a perfect scenario like this, right? In the unexpected. But Rana, it sounds like you're just, really jumping into a lot of, your journey and so much about what you have gone through. I mean, there's such a component of this personal side that Dr. Hanna, as experienced as you are, and the amount of time that patients can spend with you in clinic, they're going to be asking the more, like we went through, like the logistical sides, the actual step-by-step process. I mean, and Rana, from your perspective, you give so much of this, the personal aspect, right? All of the what ifs, right? Like all of the,
right.
The emotional side of things, which is very difficult for, the other weighing factors. Like people have to weigh that into making this decision. I think we left it talking about, the community side, and, correct me if I'm wrong, you didn't have anybody, when you made this decision, you didn't have anybody that you're like, hey, like, can I talk to you? Right. Can I understand what it's going to be like?
Yeah.
And that's a major change in, how communities are today, is that, as I was saying, is we go to the people around us to ask for recommendations for almost everything in our lives. There's no difference in health other than the fact that it's the most important decision that you guys are going to be making. And so it's making sure that you have the availability to connect to this network of people that are similar to you,
right.
and seeing your future self in. And I'd love to know, when you were starting out on your journey, is this the future self that you thought you were going to see?
Never. No, not at all. I honestly didn't think it would go to this extreme. I'm till today, I'm still shocked. When I get dressed, and I'm still in shock. To be quite frank, I still have those moments where I'm looking at myself in the mirror and I'm like, I still see myself as I used to be. And, but I've learned to love my body. I've learned to move on with it. So, so to speak. So, but yeah, I never thought I would be at this weight, and this much. It just changed my lifestyle. So no, I didn't. I was very surprised.
I mean, and that's why I know we love this photo. It's like, you just like climb the mountain, conquer the world, right?
Yeah, that's how I do it.
It's this entirely version of yourself. And that's, there's so much more that comes along with this. I know we talked.
The energy that I have now is unbelievable. I mean, I'm ready to go at any time. You tell me, let's go hike, let's go. I love the outdoors, but I never had that in me. Now it's like paperweight. Let's go, ready to go. It's so easy. Yeah, no. When I was climbing that mountain, yeah, I was up there. I was ready to go. So I was excited.
I know you talked a little bit about, what the challenges were. What are the biggest changes that you've been able to see in your life? And what are the things that maybe people aren't thinking about prior to surgery when they're thinking about they're thinking about the immediate impact? What are the things that, you found out about yourself or that have changed in your life that you didn't think were going to be possible?
I didn't think I had that much strength, to be honest. It really takes a toll on you mentally and physically. And that part, I wasn't expecting the way it did for me. There was on that plateau, I remember I had lost about almost half the pound, half my size. And I think it was 143 pounds at that point. And I was like, that's it. It's just stuck. And I'm like, oh, I won't lose anymore. But that affected me mentally, because I'm like, well, what do I do? How do I do? And then and then at that point I was like, okay, I'll be fine. And then the hair loss and all that affected me mentally. I didn't know, I didn't want to go out as much. I didn't know how I would look, and then you see like I would feel like people are looking at me, and it's just a weird mindset that you're at. But then but then, once you see yourself in a different mindset. So I had to really work on myself. I really had to sit down and talk to myself. And I said, well, if this is the outcome, what next? You're going to sit in your house and just stay by yourself. So let's do this. So then I just got more active. But it did bring me more confidence more than anything. And the first year was the hardest because I didn't know what to expect. So, it's like, okay, I'm learning to change my lifestyle of eating habits, but then what? Then I had to learn how to exercise properly, what works for me. And then I wasn't a person that liked to exercise. Now I go every day. It helps me mentally and physically.
Perfect.
Now. So you just learn about yourself more. I learned that I do like to do yoga. I learned that I do like to go out. I love the outdoors, little things like that. When I'm out around people, I have more confidence in myself. So it's just your mindset of when you're ready. When you're ready, it goes so long with you. And so that's the beautiful part of when you do the surgery.
I love that's the great that you have an open mind and you're willing to change. So that's really a huge part of this whole process.
Yeah.
Because most of us are just stuck in a rut, just doing the same thing every day over and over. Say if you're in an exercise regimen, you're doing the same routine over and over and over. Yep. But you've explored different things, which is amazing, which most people do not do. So getting into this program, doing the surgery, it opens up a whole new world for adventure. So once you start to lose the weight, you realize that, oh my gosh, I feel so much better. Like you say, the energy is amazing. So now I will try this. So don't be afraid to try different things.
Don't be afraid. I mean, that's, it's one of those things that I feel like we've all said in a different way, which is you can't be afraid to make that first step. Right. Yeah. And, that's a lot about what we focus on too, is that a lot of people think the first step is jumping into the surgery. Well, the reality is the first step is having a conversation. And we're here all having a conversation and is to connect and have these conversations happen, both from, the professional and the medical side, as well as the personal side. But in those conversations, we get a lot of questions, and we did get a lot of question submissions, in the signups, which I'd love to run through these. I know you may have touched on some of them, but, for some of the ones that you haven't touched on, these are what the audience has really asked the most of. And we'd love to just kind of run through these, as for the ones that you may not have touched on as much as others.
Sure. Is surgery safe? It's very safe. Very different from 10, 20, 30 years ago. Anesthesia, procedure, we use the best technology. Our instrumentation is way better than it was before. Minimum. So our risk and complication rates have gone down dramatically. So it's a very safe procedure. When you talk about weight regain is possible. So the key to that is what Rana is doing. She's living the lifestyle and being mindful of her daily choices, so that's really the key to that. You can't go back to old habits and revert back to what you were doing before. When we talk about insurance covers the surgery. Most insurances do. There are some insurances that have exclusion for bariatric procedures. And if insurance does not cover it, there is cash rates. So we do have that, and it's on our website. So patients who fly in from out of town, out of state, where cash pay, that's available. And there are also financing options too.
And I'm curious, one of the questions that actually just came in that I think is really interesting that, I've heard a ton of is what is, kind of the lowest BMI thresholds that folks to be considered for surgery? Like what is that threshold typically?
So the lowest is the BMI of 30, in our initial, we talked about 35 BMI or greater, but that's for insurance purposes. The ASMBS, American Society for Metabolic Bariatric Surgeons, actually allow us to do surgery on lower BMI. So now there's that low BMI out there, 30 to 35, which is not covered by insurance, but patients can pay out of pocket if they're in that range and they do have health issues. So they're now considering low BMI for patients who have diabetes, high blood pressure, stuff like that, that really would benefit from the surgery.
And one off topic, I mean, we're also seeing questions coming around this is what surgeries would you say that, you perform the most of? Because I know that there's a variety of different types of weight loss surgery. What are you perform the most of?
Right now, the most surgeries we do is gastric sleeve. It's just the kid on the block, as I say, because it's easy, straightforward, and you have great results. We started doing these surgeries many years ago, and I've been doing this now for 18 years. Back then, all we did was gastric bypass. Then the bands came. We did bands. We did hundreds and hundreds of bands. Now, I haven't put a band in over the past 4 years. The bands have been phasing out. So we're doing a lot of revision surgeries. We're actually removing bands and converting them to other procedures. And then the bypass, we still do bypass. It's just a bigger operation that you really don't have to do a large operation if you're mindful and you're doing it the right way. So gastric sleeve really is the procedure of choice today because it's a simpler and easier procedure, and we still get great results. We still have resolution of comorbidities. So I would say 80 to 90% of the procedures that we do are gastric sleeve.
Got it. Amazing. And Dr. Hanna, thank you so much for running through those. I know that those are the ones that Rana cannot speak to on your behalf, but there are some that I know that are much more of this personal patientized approach, which are talking specifically to pain levels. And I know it's probably different for everybody. Rana, I mean, can you talk a little bit about some of these questions based on your own experience?
Yeah, my pain level, I didn't have that. I can tolerate pain, to be honest. So, and it wasn't to the point where I needed to take pain medications. I think the recommendation was Tylenol, and I think I took it just the first night, just because my body felt kind of weird and I was worried what would happen overnight. That was the time when I did, but I didn't take anything else after that. I think within 2-3 days, my body felt back to somewhat normal. And then I just didn't have that pain. The pain isn't there with everything else. The biggest lifestyle change was obviously every day is a change. Every day was the change of how to eat, what to eat. There are days where I would eat. When I started eating back to being on solids, bananas I couldn't eat for a while. Eggs I couldn't eat for a while. It just didn't sit right with my stomach. So I would phase those out and then try them again in the next month or two. It's like you're doing it like we talk about, like being a baby, starting over from the liquids all the way back to mashed foods and
Right.
things that you can eat normally. And there's even like my biggest thing is ice cream. I love ice cream till today, but I can't have certain ice creams. I could have more yogurts than I can ice cream. Ice cream does not, the formula doesn't sit well with my stomach. I can't eat it till today. So I just mindset. So I just have my yogurts, and that's usually the best.
Slight changes. It's those
constantly. Yeah, it's you learn how to eat. You learn your body. You learn what your body can tolerate. So and I'm a big foodie. I love to eat. So I like to go out. I like to enjoy my meals, but I'm very mindful of how I'm eating my meals also. The funniest thing is when I go out to restaurants and I order something and then I don't finish my meal, and all the waiters are like, "You didn't like your food. I'm so sorry." I'm like, "No, I do. I really do. I just can't eat very much." So what, do I have to go explain it now? I've had weight loss surgery. Here we go. But it's been a topic before at restaurants, and then people were like, "Oh, from the next table, really? How does that going?" And oh, and what do you recommend? Do you recommend it? Which one did you have? So other people have thought about it. So the fact that when I'm sitting and somebody else asks, it's a beautiful thing, because why can't I just help as well? Give them some answers that they have.
If you're willing to share, one thing I think is be really interesting is, the changes of relationships, right? How are there, and if you're willing to share, I mean, have any relationships that are close to you or new relationships formed because you have these, you went through this surgery?
No, I think it's more personal than it is with anyone around me. It's mainly me. I think the hardest part with those around was during my emotional phase, because, like I said, with my hair loss, and I would see my body changing drastically. That affected me mentally and physically. You know, that when I felt people were looking at me. I felt people were judging, and they weren't. It's just me, the way my mindset was. But if anything, I think it brought people closer. I became closer with everyone around me because I wasn't trying to distance myself because of how I thought I looked at some point. Um, you know, being Middle Eastern, our communities were very, very close. So
Oh,
just
yeah.
being out there and being involved, I would try to stay away sometimes from all the gatherings. But no, now I'm the first one there. I'm the first one ready to go. And I just have that confidence of being there. I'm like, I stand in and I make sure that I'm being noticed at that point. Like, I'm here, I'm ready to enjoy myself and enjoy the people around me.
I love that. And
That's
last, I
amazing.
mean, I'd love to know from the both of you, what got you involved with Patient Partner in the first place?
Well, I got lucky with Dr. Hanna giving me this call and saying there's this new venture with Patient Partner. And I think before you even finished, I said yes, because it's something that I do believe in. I do, and I have people around me that have gone through the same surgery, but they didn't have anybody. So they would see me and they're like, oh, there is a life after it. And then they would, I would give them advice even after their surgery. I would be by their side. I would, help them out with their meals. I would, you have to have a partner. Anytime you go, if you're going to go do a diet in general, you want a partner with you to go through your lifestyle change on that part. So why not have somebody with like Patient Partners who can help you succeed, help you learn, help educate you. And it's all about education at that point. And then with Dr. Hanna, it made it so much easier because he's been through it with me. He's been that confident for me. So
I love that.
Yeah, and for me, with Patient Partner, I heard about it this past year because it's all new. And, I've done, thousands of surgeries in the past 18 years. And over time, we have patients who are starting our program. And many patients may ask, do you have anybody who had the surgery that I can talk to? And in the office, we have our little running list. We have our running list of our little mentors, our favorite people that have already volunteered. So we would give a name out here and there. And we just wasn't putting this out as a huge platform as much as patients can benefit from it. And as soon as I saw a Patient Partner, I was like, oh my gosh, this is it. The platform is there. And this is a much bigger scale than I can do as a small practice. So I was just so excited about that. And as soon as I got the call, I started calling all my patients. I'm like, guys, come on. Here it is.
We love that. And again, guys, I mean, this has been such a great conversation. And I just want to say, one, thank you for everybody who tuned into the webinar. And, I hope you guys understand what Dr. Hanna is doing, and, the work that he does every day is so amazing. I mean, it leads to results and these relationships, as you can so clearly see between him and Rana, and just their enthusiasm for, helping people it's almost like it's one of the most special things you can find. And it is truly, what builds our platform. It's what makes it possible. And it wouldn't be possible without you guys. So one, the webinar, of course, wouldn't, but everything we're doing wouldn't. So thank you guys so much for also spending time out of your day and speaking to this audience that, is here out of curiosity. They're here looking to make changes in their lives. And, it makes all the difference in the world to us and to all of them. So just thank you guys so much for participating in this.
You're quite welcome. Excited to do this.
I love it. I love it.
I love it too. We should do it once a month.
That's it. Well, we'll keep going. We will keep doing it.
Let's do it.
It's all about having passion for what you do. And I'm a strong believer in being passionate about what you do. And, when you go to work and you do what you love, and for my patients who actually really benefit from this. Ron is a living testament, like I say, and that just brings me joy to see that and get the results that we get. So I'm so happy to be a part of this, and I'm so happy that my patients are willing to share their stories. So it's amazing.
We love
Thank you.
every part of our community, and it's possible because of people like you. It really
Thank you.
is. I wanted to remind everybody, again, this webinar is being recorded. A copy of it's going to be sent out to you, and it will include all the great information, and it will be able to direct you, directly if you are looking, right, and you're in this journey of wanting to go down and figuring out what this surgery actually could do for your life, right? That's possible on our platform. You can come to www.patientpartner.com/weight-loss, and you can connect with a professional just like Dr. Hanna, if not Dr. Hanna himself, who will be sending out his contact information as well. But as well, if you just want to have that initial conversation, just to understand a little bit more intimately specific to you about what it's like to go through, you can as well talk to one of our mentors, just like Rana and Rana herself. So again, you can come straight to our platform. We'll be sending out a follow-up email with the webinar with all of these instructions as well. So again, thank you to everybody who made this possible and who joined today. And any feedback is completely welcomed. We are super excited with everything we're doing. We're super excited to be helping you guys, and excited just for all the things that are coming our way.
Awesome.
Thank you.
Thank you.
Good to see you, Patrick. Thank you, Rana.
Thank you.
Likewise,
Guys.
everybody. Take care.